when I moved here. I was the only obstetrician gynecologist in this county. Women were walking in with absolutely no prenatal care. At least once a month, a woman would walk into the emergency room with a dead baby. My focus when I first got here was to give all women access to obstetrical care. I was born in England, but grew up in India. My dad was a chief of surgery at Bombay Hospital, and I remember him taking care of people in our living room. People would just line up outside our door, and he would just usher them in one at a time and actually perform little tiny surgeries in our living room. He did not need to take care of these poor people, but that inspired me to also care for people. I did all my medical school training and then moved to California. I practiced in Beverly Hills for 2 years, and there's so many doctors there. You feel like women have very easy access to care. California Medical Association puts out a bulletin of physician shortage areas, and Clear Lake was on that bulletin. What struck me with this list is I could go someplace where women do not have access to care, and that's what I really wanted to provide. Came up here and loved it here. That was in 1990, and I've been practicing here ever since. We started just in a room in the emergency room, and then administration helped us, and we created a clinic. It was very challenging. I was used to working in a hospital where anesthesia was in-house, where there was somebody you could call if you had a problem, there was backup. But here I was pretty much isolated. I was here all alone. That's what inspired me to go overseas. I figured I can do it here in Little Clear Lake. I can take this program anywhere. In 2009, a surgeon invited me to go to Chad, and he said that women basically lacked women's health care. It was heartbreaking to see women dying, babies dying of preventable causes.
There were so many mothers dying and children dying because of lack of facilities after they were born.
First time I heard a wail, like a mother losing a child, was in Chad. And it's just something that hits straight to your core.
When I got back from Chad, I was really in shock to see the huge amount of need for care. So instead of moving to Africa, I created Worldwide Healing Hands as a way to help women get access to care. We've been to Chad, to Nepal, to Uganda, and we've been to Haiti 5 times. When we first went to Uganda, there was one OBGYN serving a population of 2 million people. When we agree to go somewhere, we ask them to commit to bringing in doctors, midwives, nurses from the whole region for us to do training. To date, we've trained over 200 doctors, midwives, and nurses.
I just love the fact that we're going and teaching something that they can teach, that they can continue to use. And I just envision teaching one person, it's spreading, it's spreading, it's spreading, it's spreading, it's spreading.
We were able to measure our success by going back to a place and seeing that there's been a decrease in maternal mortality.
What I love about Dr. Dhandas Passion is it's not just about the world, it's about right here in our community that really needs that special touch.
For our little tiny hospital, we really give state-of-the-art care. When I first came here, we were successfully performing laparoscopic surgeries that were not even being done in Santa Rosa or some of the bigger hospitals. In 2014, we started a program to take care of the homeless. Our volunteers will go and offer free medical screenings for the homeless or the indigent. On one of our recent homeless screenings, there were 2 women that needed surgery, and within 30 days I was able to bring them in and perform the surgery that they needed. There's still huge need for physicians in Clear Lake. I think the hospital's doing a good job of bridging some of that with telemedicine.
Dr. Dhanda's work here and around the world is the epitome of service.
Dr. Dhanda has got to be the most brilliant, intentional, and kind person on the planet.
She's just extremely compassionate, and she just is always thinking of ways that you can help others.
She has such a big heart, and she wants to help everyone she sees in need. She's just the kind of person I aspire to be, because look where she is now. She's helping people all throughout the world.
Adventist Health has been really supportive in everything that I've done. This hospital has always been there to support me financially, with equipment. I don't do this alone. I do this with the help of our volunteers, with the help of our donors, and with the hospital supporting me. I think volunteers are a really special breed of people. Some people, we say the glass is half full or it's half empty. Well, volunteers take the glass and say, who needs a drink?